Welcome to this session on global health, and we are going to be talking about men and health-seeking behaviors in Africa. And I have with me an all-African panel. To my far left is Dr. Mulinda, Nyirenda, and next is Brian Kanyemba, and on his left is Nhlane. And finally, we have got Adeolu from Nigeria. My name is Tapiwanashe Kujinga. I'm based in Zimbabwe. So what I'll do is I'll let my panel introduce themselves, tell you what they do, and then we take it from there. Thank you. Mulinda?
Thank you. I'm an internal medicine specialist from Malawi, working at the largest hospital in Malawi called Queen Elizabeth Central Hospital. I've also been, apart from seeing adult patients, I've also been doing a lot of clinical research related to HIV and other infectious diseases.
Thank you. Over to you, Brian.
Thank you. My name is Brian Kanyemba. I work for the organization in Cape Town called Desmond Tutu HIV Foundation. Primarily, my work is to do HIV research in clinical trials and advocacy in implementation research. That I work closely with the South African National AIDS Council again in South Africa, and extend my work into the global perspective, which include men of African continents on men who have sex with men.
Thank you.
I work with people living with HIV and AIDS. I work for an organization called the Zambia National ARV Support Program. This is an organization that is used as a first point of contact after people living with HIV have been tested and enrolled on ART. The nurses or the clinic staff will refer them to the support group, and support group members will take it upon themselves to provide treatment literacy and adherence literacy to the newly enrolled individuals.
Okay, my name is Ogunrombi Adeolu. I'm a public health professional. I work within West Africa region. I basically focus on people who use drugs and basically focusing on public health intervention in terms of HIV prevention and other infectious diseases among people who use drugs through policy reform and interventions at the community level. Thank you.
So thank you. Now to kickstart the discussion, I will start with you, Dr. Nyirenda. Within the context of the HIV pandemic, Africa is the most affected and infected. And what has been your experience in mental health seeking behavior when it comes to HIV infection? Well, what have you experienced over the years?
Thank you. Indeed, with the way the epidemic has actually affected our continent, in terms of men, health-seeking behavior related to HIV, it has been indeed something that we need to work on. What we've noticed is that indeed the uptake of HIV testing is lagging behind amongst men, especially the young man, who probably is affected by not being too sick, or among others, and not arriving at the hospital on time. In addition, we have noticed that even just probably we could say, is it cultural or just in general, because men are busy, they are the main financial breadwinners. They don't have time to go to the hospital, so it takes time before they acknowledge that they're sick, and so arrive at the hospital pretty late. A bit late late rather, we could say, with advanced illnesses that result in problems in how we handle HIV treatment when they arrive. The uptake in terms of relations to sexually transmitted diseases probably does improve, but still uptake for HIV testing is still lagging behind. So those are definitely things that we should work towards improving if we're going to indeed target for men to know what their status is, but also to be able to influence treatment as well as retention of treatment for care, because that's another thing that, apart from being sick, when men start feeling better, it has been noticed that they do stop their medication. And so that has a problem with adherence issues related to HIV infection treatment.
So Nhlane, you are working with people who are living with HIV, and in that capacity you will be able to tell how many men are coming up for testing and for ART, and how many women are doing the same thing. Do you concur with Dr. Nyirenda's observation?
Absolutely, absolutely. Even in agreeing, I want to explain that men take their medications for different reasons. The men that I've interacted with, the main reason for taking medication is for survival, as opposed to taking medication to maintain their health. So they will only, which translates to their reasons for wanting to access health services. It is the same. They want to access health services because they want to survive, because they are too sick, as opposed to wanting to access health services because they want to maintain a good health way of living. And where we've lagged behind is that the community involvement that when we started, our major community involvement, we excluded the man. I mean, I want to bring in an aspect of, let's say, prevention of mother-to-child transmission. Yeah. For me, I think just the way we coined it, when we said prevention of mother, when we just said mother, the man said it is a woman's problem, it is not my problem. So this is where we need to start rethinking our way of programming. I've been a victim. I'm driven to come up with programs that are women-oriented, because it is the women that are available to do the programming. And I agree with Doctor that the men's reasoning is that they are too busy. They've got a lot of, they are breadwinners. So the moment, even when they get better, the moment they get better after when they were sick and they're taken to the clinic and they get better, their initial focus is that they want to go to find food which they must provide for their homes. Basically, that is one of the reasons that they give. Okay,
I'll come back to you later, just to tease out some of those issues. But I'll come to you, Adeolu. Now, yours is a different world altogether, because, you know, we don't have, I presume, a lot of people who use drugs in Africa, especially injecting drug users. What can you say about this whole topic in terms of people, or men specifically, who use drugs? Is the attitude towards health the same as people or men living with HIV?
Okay, thank you, Tapiwa, for the this interesting topic and the question. Broadly talking about men and health in Africa, it's an interesting question, because if you look at some of the available statistics on life expectancy, comparing, life expectancy of men with women, you find out that, look, a lot of factors, contributes to the reason why the life expectancy of men is usually, lower than that of the women, within the in some African settings, and time will not permit to really look extensively into that. But narrowing down to the question you've asked about people who use drugs within the African setting and health-seeking behavior, you find out that, look, this is actually, a community of people that are somehow hidden, and the same factor that affects the general population in terms of men and health-seeking behavior also affects them. And I would like to narrow this down into two perspectives: the individual factors and the structural, factors. When you talk about the individual factors, you begin to look at what level of information is available to them? You know, what is their knowledge level? Do they, what constitutes a healthy person is different from what you consider as somebody who is healthy, is different from what I consider somebody who is as a healthy person. Another person considers what is, constitute an healthy person. So with this disparity, an average man within the African context does not easily present to the hospital or maybe go for medical checkup whenever they feel an ailment or the other. They feel, look, everything can actually be managed and be well done. And in terms of beyond the knowledge and of the individual, you also talk about some behavioral practices also that put men at risk. Of course, the masculinity factor, always want to take risk, always want to do this, and one thing or the other, also put them at risk. But do they actually, and whenever they are sick, do they go to access services? We ask ourselves the question, are these service provision centers available? Are they accessible within their reach? What is the economic cost of accessing these services? And like Doc rightly mentioned, some of them, many men are the breadwinners of their families, and they have meager resources. So if before I can go to a hospital to use money to access services, I will first think about how the opportunity cost. How this money is capable of putting food on the table of my family, is capable of feeding my family, is capable of paying my house rent. So I will try to trade my health for that at first. So these are some of the issues. Then the structural challenges, which are policy issues. How many, in terms of accessing health services, most health expenditures are still out of pocket expenses. We don't have health insurance, making health affordable. So the incentives and motivations even for men to change their, to have a positive health-seeking behavior are also not there. So is a myriad of factors, the individual factors, knowledge about their health, the challenges about their health is actually low. Then individual behaviors and some of the structural challenges in terms of economic factors, policy constraints, and all these are issues that affect the general population. And the same thing can be related to the community of people, men who use drugs within the African setting.
Thank you very much. So talking about another hidden population in Africa, I will let Brian talk about MSM in Africa.
Thank you, Tapiwa. And I think the panelists have actually raised a lot of issues. And now coming to MSM, men who have sex with men in Africa, is really a hidden population, and it depends which country you're coming from, and differs actually from, as I'm coming from South Africa, but differs to all the other countries. One thing that goes to what everyone was saying is, where do we draw the line, especially on HIV counseling and testing, and again linkage to care, and how does that link to MSM and to a gay men initiative? One of the things that is really important is, even in those areas where MSM are not criminalized, an individual as an MSM is actually afraid to seek health-seeking behavior. Why? Possibly afraid to actually talk to the doctors about what are the issues that MSM is facing. Like for example, what the last speaker was saying is the issue on structural issues. Like for example, if someone has got an STI, now to go to the next clinic and talk about the STI that person has, and it has got different symptoms from how another male person, a heterosexual male person, manifests the same STI, because they are coming from the different areas. Research has shown us that these MSM actually are like first stigma into the healthcare system. So health-seeking behavior become a little bit far-fetched, and are actually afraid to actually go and sort of seeking behavior, which means what we need to address, possibly involvement in the healthcare system a curriculum whereby we're talking about sensitizing healthcare workers in how do you get, how do you see a patient and an MSM patient who is not, conveying the symptoms that are coming from the other factors. And again, when talking about structural issues, I really understand that our African men, they are really affected by high unemployment rates, are coming from disadvantaged background, and this actually affect MSM too, and it's actually one of the things that is increasing the STI and HIV pandemic among MSM. And possibly at the end of the day, what is needed is how do we warn back and talk about the issues that govern everyone else, and on the perspective of, is it an MSM, is it a heterosexual male?
All right, thank you very much, Brian. So in the very few minutes remaining, I will ask each member of the panel just to give your perspective on what would be the best approach to ensure that men in Africa adopt health-seeking behaviors, looking at the programmatic, economic, social, and structural factors that have been identified here. I'll start with you, Nhlane. What do you think needs to be done, especially looking at people living with HIV?
For me, who's specialized in handling people living with HIV and AIDS, what I can say is that this is the time that we need to continuously remind ourselves every day that we need a vaccine. A vaccine for prevention of HIV and AIDS.
All right, thank you. Dr. Nyirenda, you are in the hospital setting, you see people on a regular basis. How do you think men can be channeled into clinical care rather than coming when they are at emergency stage?
So indeed, strengthening health promotion messages that target the man will be very important. But also I think what's important is for us in health facilities to become more patient-oriented. Patient-oriented, where my encounter in a health facility makes me want to come again when I need it. So indeed, what we need to focus on is making our health services friendly, and especially man-friendly. We've focused a lot on being woman-friendly, but make them more man-friendly so that we can make it pleasant enough for the men to come into the hospital, not just for when they're sick, but even just for a piece of information. I think that will take us a long way than we have been doing so far.
So maybe adopting a family-centered approach, where you're just not focusing on one member of the family, but adopting a more holistic approach, where you're looking maybe not only at the woman, not only at the man, but also at the children and at the broader extended family.
Very important. That's the whole essence of why we exist. And Ubuntu is about knowing that a family is not just about the woman or the man, but we all exist together.
Thank you. Ade, what would be your suggestion?
I'll say, basically we should increase the health incentives and motivation for men to access services. And by saying this, I mean we should widen the health policy space, and by implication making health services available, affordable, accessible for men at every point in time that is required.
Thank you. I have to come back to you, Nhlane. You mentioned programmatic barriers, which effectively bar men from becoming involved in some of the programs. How would you restructure the programs to make sure that men are accommodated?
For those that have known me for a long time, have known that I have been an activist who has advocated for the change of the terminology prevention of mother-to-child transmission to prevention of parent. Because the moment we start saying parent, even the man takes responsibility. And the moment we start saying mother-to-child, even the child that is born will start thinking, even a child who's born with HIV, they will always be told you contracted your HIV from your mother, because it was mother-to-child transmission. But if it is parent, then the child will grow up knowing that I contracted it from my parents. It becomes different. And for me, I think that's where we need to start making changes from.
Thank you. So we need to make sure all our programs are men-friendly, just like hospital services will become family-friendly.
Family-friendly.
Yes. And then that will, make men more comfortable to participate. So that brings us to the end of our discussion. It leaves me to thank my panel for the very rich discussion on men seeking behavior in Africa. The perspectives which have been shared here are probably more common in many of the African countries, and we need to ensure that men adopt health-seeking behaviors. We need to make sure that men are also supportive of their families and their wives in order to enhance access to health. So thank you very much for watching.